The Hysterolux fluid management system consists of a control unit with an integrated vacuum source, a portable scale with space for up to 4 disposable canisters, a vacuum regulator, and disposable tubing sets. The user-friendly touchscreen controls the operation of the system and displays important information. The top-level number shown is the current intrauterine pressure, which is monitored by the system. The set pressure and controls for the set pressure are below the current pressure. The set pressure can set within the range of 15 millimeters of mercury to 150 millimeters of mercury. This value defaults to 60 millimeters of mercury as a factory setting. When the scale is connected, the top right number shows real-time fluid deficit in milliliters with an accuracy of ±6%. Below the fluid deficit value is the total fluid inflow, which can be toggled to show maximum flow rate. This maximum flow rate can be set between 50 and 800 milliliters per minute. The factory default for maximum flow rate is 800 milliliters per minute. The Hysterolux hysteroscopic procedure kit contains labeled and color-coded inflow tubing, outflow tubing, and suction canister accessory kit with 4 jumper tubes and a specimen trap. The sterile inflow tubing has 2 bag spikes, the cartridge for insertion into the pump, and a blue lure lock for connection to the hysteroscope. The outflow tubing for the handpiece has white connectors and is labeled handpiece. The outflow tubing for the under buttock drape has blue connectors and is labeled drape. The outflow tubing for the hysteroscope has yellow connectors and is labeled scope. The 4 non-sterile jumper tubes are used to tandem the canisters together and attach the canisters to the vacuum regulator. And finally, the tissue trap collects resected tissue so it can be sent for analysis. The Hysterolux fluid management system can utilize a 2, 3, or 4 canister setup. For the purposes of this demonstration, we will use 4 canisters and begin by connecting the lids to the canisters. The lids each have 3 smaller ports, labeled suction, patient, and tandem, and 1 large access port. Begin with all ports open. The first thing we will do is set up the scale and canisters. Begin by hanging 3,000 milliliter bag or bags of normal saline on the scale hooks. Load 4 canisters by placing them inside the canister holder. The canisters on the left side are for the drape. The canisters on the right side are for the handpiece outflow. The first connections will be for suction. Connect the integrated vacuum source to the bottom valve of the vacuum regulator using the vacuum tube set. Note that this tube set can remain connected between cases but must be changed every 30 days. Set the valve lever at a 45-degree angle. Using non-sterile jumper tubing, connect the overflow canisters to the front canisters using the tandem ports on the canisters. The back left canister will connect to the drape outflow front canister and the back right canister will attach to the handpiece canister. Next, attach elbow connectors to the middle suction ports of the 2 back canisters. Using non-sterile jumper tubing, connect the working port of the vacuum regulator to the elbow connector of the back right canister. Then connect the drape port of the vacuum regulator to the elbow connector on the back left canister. Insert the specimen trap into the large port in the front right canister and connect one end of the tube set labeled handpiece. The other end will connect to the handpiece. Connect the tubing labeled drape to the patient port of the front left canister. The other end will be connected to the under buttocks drape. Once this is complete, close all remaining canister ports. We will now set up the connections to the hysteroscope and ready the control unit. Attach the blue lure lock of the inflow tubing to the inflow port of your hysteroscope. Attach the hysteroscope outflow tube set to the hysteroscope with the yellow lure lock and drop the other end into the drape. Attach your camera head and light cable. After the scale and canister setup of the Hysterolux fluid management system is complete and the hysteroscope's connections are attached, you can activate your system control unit. Ensure that there is not an inflow tube set already inserted into the tube retainer before turning the system on. Press the on-off button once. You will see the Covidien logo and progress bar while a self-diagnostic test is performed and the system starts up. When the system is on, you will be prompted to insert a tube set. Identify the inflow tubing cartridge and slide it into the tubing retainer on the control unit. Notice that an arrow indicates the direction of insertion. Place the roller tubing section around the wheel and snap the locking ring into place. Once the tube set is inserted, you will see "Tube set accepted" on the screen and hear an audible confirmation. Spike the saline bags and open one clamp. The system is ready for instrument recognition. If required, insert the calibration insert into the working channel of the hysteroscope. Have the scrub tech or surgeon hold the hysteroscope parallel to the working height of the patient's uterus. Open the inflow stopcock on the hysteroscope. Turn on the vacuum pump. The button turns dark gray when it's on. And check suction on the canisters. It may take a few seconds for the suction to reach the level across all canisters. Press the start button once to start automatic instrument recognition, which optimizes system operation for the specific hysteroscope you are using. Approximately 200 to 300 milliliters will flow through the hysteroscope during this process, and once complete, the system will give an audible signal and display "Instrument recognition complete." Close the inflow stopcock on the hysteroscope. Before beginning the case, reset the fluid deficit by pressing and holding the button on the touchscreen. The system is now ready for the procedure.